Hey, everybody. We are continuing our year of gratitude. And today I am incredibly grateful for this podcast review because it came from a precious, sweet moment. So thank you to Julia Michael, SLP, who gave us a 5-star review and called this an incredible podcast. She said, "Hi, Michelle and Aaron. I absolutely love your podcast. My name is Julia and I'm an SLP. I met you back at ASH in New Orleans with my SLP mom. I listen to your podcast every week and even go back and listen to older episodes I haven't heard. I'm an early intervention SLP in Washington State. You have both inspired me so much to continue my lifelong journey of learning. Some of my passions you've helped me foster are around AAC, neurodiversity, floor time, pediatric feeding, parent coaching, counseling, and so much more. Thank you for filling my cup every week. Much love to you all and all that you do." Julia, this is literally why we do this thing, because we are all part of this beautiful village that's called to serve the least of these. And it is an honor. I'm going to cry because it was really nice to meet you in person. It was an honor to meet you and your mom. And it's an honor to put joy out there every week by highlighting all of these phenomenal guest speakers and researchers and expediting research to practice to make our village stronger. So thank you for your review. Y'all, thank you for going on this journey with us. And cheers to 1.4 million downloads that we reached last week. And thank you for being a part of this. Hi, folks, and welcome to First Bite. Fed, Fun, and Functional, a speech therapy podcast sponsored by SpeechTherapyPD.com. I am your host on this nerd venture, Michelle Dawson, MS, CCC-SLP, CLC, the All Things Peds SLP. I am a colleague in the trenches of home health early intervention right there with you. I run my own private practice, Heartwood Speech Therapy, here in Coletown, South Carolina. And I guest lecture nationwide on best practices for early intervention for the medically complex and fragile child. First Bite's mission is short and sweet, to bring light, hope, knowledge, and joy to the pediatric clinician, parent, or advocate.
By way of a nerdy conversation, so there's plenty of laughter too.
In this podcast, we cover everything from AAC to breastfeeding,
ethics on how to run a private practice,
pediatric dysphagia to clinical supervision,
and all other topics in the world of pediatric speech pathology. Our goal is to bring evidence-based practice straight to you by interviewing subject matter experts.
To break down the communication barriers so that we can access the knowledge of their fields.
Or, as a close friend says, to build the bridge.
By bringing other professionals and experts in our field together, we hope to spark advocacy, joy, and passion for continuing to grow and advance care for our little ones.
Every 4th episode, I join in. I'm Erin Forward, MSP, CCC-SLP, the Yankee by way of Rochester, New York transplant who actually inspired this journey. I bring a different perspective, that of a newish clinician with experience in early intervention, pediatric acute care, and nonprofit pediatric outpatient settings.
So sit back, relax, and watch out for all our squirrels and enjoy this geeky gig brought to you by SpeechTherapyPD.com. Okay, everybody. So today we're continuing my 40th birthday celebration the entire month of March by surrounding this month with some of my favorite people. And I have the total joy, and I'm trying really hard not to cry, to introduce one of my dearest friends, Melissa Davis, MS-CCC-SLP. Melissa from Mississippi, as the boys call her. And she is a SLP soul sister, kindred spirit through and through. In truth, I don't remember how long ago you and I met. It was several years ago, and it was at a conference, and then we just clicked like peanut butter and jelly. And she even came and visited me in Columbia, and we sipped wine and giggled and laughed and cried and decided to change the world one advocacy event at a time. and by raising incredibly good humans. I love you. So thank you for coming on. Also, I can tell you her and her crew really know how to throw down on a late night at Asha. So there was nothing quite like walking through Bourbon Street.
Really good time.
Good times. Also, on a side note, she's so meticulously planned every aspect of this recording. And then at the last possible minute, none of the speakers worked. So I know y'all only get the audio and you can't see the video, but sweet Melissa from Mississippi is hunched over speaking into the speaker. And if you need ibuprofen after this recording, I apologize. So, hi.
It's going to be worth it. It's going to be worth it. And thank you so much for having me. And you're going to make me cry because you're even more special to me than maybe to you. And it's been a while since we met. It was one of your conferences. And I mean, just the moment you stepped out there and started talking, I just went, oh my goodness. Do we know each other? Do we all know each other already? So I'm the blessed one. So thank you for having me. I'm just so glad to talk to you today. And yes, even if I'm leaning over my desk, it's worth it. It's okay.
Amazing. Okay. So now Melissa is actually about to become a generational SLP in her family because we have it on good authority that your daughter's planning to enter this profession.
Yes, fingers crossed she still goes into it. I'm praying. She's a junior in high school right now, so she said she's going to, so I'm going to keep that, continues with that thought. I'll cross our fingers and say our prayers.
Yes. Okay, so take us back from the beginning. What made you want to be an SLP? And then you went out on a limb and created your own private practice there in Mississippi. So, can you take us down that journey?
I would be glad to. The coolest thing is, I was back in college, I don't remember, probably 19 years old. I went into a junior college and said, just told my parents, I don't know what I want to major in. And I was reading the paper because, back then we actually read the paper and stuff. I'm that old. But I read an article of an SLP in a hospital that helped a child learn how to drink from a bottle. And I was fascinated. And I ran in and told my dad, I said, I know what I want to do. I know what I want to do. And so funny, he's like, oh my goodness, I can see you doing that. Because he and my mom both said I used to always try to correct, or fine tune the way I'm saying things. Like, I would say Pescetti and they thought it was funny, but I would say, well, how do you say it? And, even from very early on, I did that. And then this one article really touched my heart. And now, to go full circle, and that's what I do is feeding, especially with itty bitties. It's great. And I moved off to Tennessee, went to Middle Tennessee State in Murfreesboro, Tennessee, and got my undergraduate there. Then reconnected with the love of my life, my Adam Davis, from church camp. And we got married, moved back to Mississippi, and I got my master's degree at Mississippi University for Women in Columbus. And worked in rehab company for two rehab companies, actually, for about 7 years. And I did early intervention in the homes. So that gives you such a phenomenal perspective of the real life with kiddos. And I was so blessed to work alongside some phenomenal PTs and OTs and learn their trade because, we had heard about them in grad school, but not truly learned what they did and how we need to work together. And so it's crucial. And so, well, actually, the PT that I worked with the longest time and then another OT, we are the ones who kind of, after working together for a while, we said, y'all, I wonder if people would come to us. Because some of the homes, I'll be honest, were getting a little bit dangerous. And we were spending so much time on the road that it was just getting hard, let's just say. I won't go into too many details on that. But we said, I wonder if anybody would come to us. And that was back in 2009 when we kind of just started really discussing it. And I opened up my own private practice, just myself, 2010. And here we are. I think I have 13 phenomenal employees now. And, it's so funny to describe our company because we all three started out. Yes, we are kids therapy spot, but we kept our businesses separate. I'm actually, I have my own one for speech therapy. It's actually called speech therapy for kids, but that's mine. And so anything speech therapy related is to me. Then I have my cohorts. They have their own PT and OT businesses, but we're all under one umbrella. So that's kind of our thing. We started out in the homes and like I said, we saw the benefits of, like we say, interprofessional practice and how important it is and how beneficial it is for the children, of course, for us as therapists, whether it be, to help with positioning and sensory and all the things that we know, but also for the families, because we kind of say we're a one-stop shop. You come and you get all therapy, and we've called ourselves the mom, and mom shop because, it's just for a while, it was just the three of us. And then actually my very first employee yesterday was her 11-year work anniversary. So she's been with me for 11 years and she's my right hand. So it's just awesome to think back, where it started. And I do, attribute all those years of being in the homes. You become a part of those families. And so when I'm doing things and even talking to my employees, I have to remind everybody and myself of what these kids go home to and our expectations. We can't put too many, expectations on these children and these families that aren't realistic. Just because it's something that happens at our house does not mean it's happening at their house. And neither one of those is wrong. It's just different. And we have to think about that. So on the daily, we have to remind ourselves. That's one thing that, I remind myself and, like I said, and my employees on, okay, these are goals, but we really have to make sure that we're setting these goals to be realistic for this child. That's kind of my little story in a nutshell. And I'm blessed for every step of the way and super blessed for my PT and OT cohorts that, we went into this together and we're still going strong.
I think my favorite part is the mom, and mom.
Yeah.
Yeah, because I don't like to think that I'm everybody's mother, but somehow I end up becoming everybody's mother. And now that I'm like, to be fair, it's January when we're recording this, but in by the time this is out, I'll have had 40. But now that I'm 40, I'm old enough to be my interns' mothers. This is scary business, but you exude that level of love too, so that we're everybody's mothers. Yes. Okay. You mentioned something and it triggered a thought. Y'all, there's a really good book called The Early Childhood Coaching Handbook. I think it's in its second edition. It's by Dr. Dathan D. Rush. And then there's another really good one, Through Teens-Based Early Intervention Supporting Young Children and Their Families by R.A. McWilliam. And those two books are absolutely phenomenal. I highly recommend those because what they do is they talk all about just what Melissa was talking about, caregiver coaching, and how our job is to empower the caregivers. And we can't assume, when we assume that what happens in our home happens in another home, or if we assume what happens in our home does not happen in another home, those are our hidden biases that just rear up every once in a while, right? And our caregivers may not just be mom and dad. Our caregivers can be all of the different professionals that are involved in that child's care in the course of their day, which is honestly a perfect unanticipated segue to what it is that we're talking about. Because what we're talking about today is a term called a PPEC. And if you're scratching your head like, what in the blue blaze is a PPEC? Do not fear, because the first time Melissa asked me about a PPEC, I said, what the hell did you say? Because I was like, I have no idea. But that's just it. Our world, when we go through, can be so small, but it's through interprofessional practice with our own colleagues that we see what colleagues in different states are going through and what is part of their normal. So what does a PPEC stand for?
Okay, so a PPEC, and I've actually kind of sat down, I called one of the administrators of a PPEC. We're in three of them. And I said, I need for you to give me the technical definition because I didn't want to quote any definitions incorrectly because I usually give layman's terms. So I'm going to give the technical term. First off, the PPEC stands for Physician Prescribed Pediatric Extended Care Unit. In layman's terms, it is a daycare for medically fragile children. And try to go back to when, I'm saying in the homes, how we get a good perspective of the families. And one thing we saw is how exhausted families get. And the PT I worked with so closely, Karen, I remember us dreaming one time going, I wish there was a daycare for medically fragile kids because these kids do not have that. These parents don't have that respite. They are struggling, going on all ends there. So finally, when we were back in, I think it was back in 2017, we got contacted by one of them in Meridian, Mississippi, which is an hour and a half away. Did I say it was prescribed pediatric extended care? I think I said physician. Okay, so prescribed pediatric, yeah, sorry, prescribed. But anyway, so back in 2017, when we were already obviously in clinics and things like that, we got approached by Pediatric Extended Care in Meridian, Mississippi, and said, "Hey, do y'all want to come and contract therapy with us?" And we went, "What?" Like you did. Well, what's a PPEC? What's that? And so we researched it. And even Karen and I looked at each other and went, "This is what we had talked about years ago." I mean, this is a godsend for these children, for these families. Technical definition is, the prescribed pediatric extended care facility is a center that provides physician ordered multidisciplinary daycare to medically fragile and or technology dependent children, infancy to age 21, who have complex medical conditions requiring continual professional skilled nursing care. They provide care up to 10 hours a day, and when a child is admitted, an individualized plan of care is developed for each child, specifying the treatment plan necessary to accommodate the specific needs of the child. So, all that being said, like I said, it's a day facility for these medically fragile children that normal daycares would never touch. And I always say the teachers in these day facilities are nurses, which is beautiful. These are Medicaid facilities. You have to have Medicaid. But like I said, it's beautiful because these parents, there's a lot of times they can't even leave these children with family members because most of the families, they don't feel comfortable, or the parents don't feel comfortable leaving them because if they have a trach especially, but trach, G-tube, all the things that we're aware of and comfortable with, their families aren't even comfortable with them. So for them to be able to leave their children in the hands of nurses, and you can't get better than that, because and these nurses are on top of them. Their rooms where their teachers slash nurses are in there with them and other children, so they're able to get around other children. Now some of them have, depending on their complexities, they may not be on the floor with the other kids, but they're in the same room with them. So as we know, they're hearing them, they're smelling different things, they're seeing different things, they're being able to experience and a lot more things than they are at home. And parents are able to breathe. They can drop them off and breathe. And one great thing is these facilities offer transportation too.
How is this not replicated?
I know. What happens here now, they can travel a 30-mile radius, which is great. I mean, because now some of these kids, they may live an hour away, but they can, and this is just in Mississippi, I think each state regulation is different. I do want to say that, but they can get like little drop offs where they meet and pick up another couple kids in the same area. So parents can literally, drop them off in their pajamas and go back home and breathe, go home and take a nap. When I was in the home, I remember this one mom looking at me and said, "I really wish I could get a job. I really wish I could go to work." And I said, "Oh, mama." And she said, "But I can't. I can't leave my baby with anybody." So, and then that gives her, mixed feelings of guilt there. It's not like she wants to turn her child over to somebody, but she also just wants to breathe. And if that means going to work on her own and being able to trust that somebody's taking care of their child, it's just phenomenal. So, I mean, these facilities, I mean, they're truly a godsend. Godsend. I mean, actually, one of my employees, and she would not mind me telling you this, her child has many, many, many complex medical situations going on, and I'm going to try not to either. He goes to one here in Starkville, and she's actually treating there. She doesn't treat her own child, obviously, but she's able to see him whenever she goes over there to treat the other kids, and she's able to come to work, and she's able to breathe, knowing that her child's taken care of. And, obviously with nursing, if anything emergency wise happens, obviously they can provide medical care, but also, also call an ambulance if they need to. And they're in town, so ambulances can get to them fairly quickly.
So they contract. So these PPECs, one, am thinking in my head how we can like orchestrate this like nationally, but like I'm gonna like squash that for a second because I really want you to meet my girlfriend Tessa, because I feel like we need to have insight into how to replicate this in South Carolina. Like she emailed me like honest to God 30 minutes before we went to record out of nowhere. And I was like, oh, there is a sign here. So Tessa, if you're listening, this is Melissa, Tessa. But when the children are in the PPECs, when they're there and they have the IEPs, the OT, PT, and SLPs consult out and come in. Do you know if there's, like here in South Carolina, we have a designated school for the deaf and the blind for birth to end of life care for services, but they have an actual physical school for 3 to 21. But they have like hearing impaired and vision impaired designated teachers that are there. Is that the same at a PPEC? Like, can they get a hearing impaired or vision impaired teacher there or consult?
Okay, so what PPECs, obviously, I do not own one. This is not me being the owner of one. I contract out for them, but they provide, like, without having to contract out, they provide obviously the nursing care and the transportation. They contract out ST, PT, and respiratory therapist and nutritionist on staff. I'm not on staff; they're not present, but like, I've had to call one in, I guess, a couple months ago with a kiddo that I really needed her help. And she came over and, met with the child. We looked at their plan of care and everything. But the biggest thing is they will contract all these necessary things out. I know that they contract out teachers. And because a lot of these kids cannot, attend, quote, normal school. However, they are able to have some teachers come there. And I know that there has been a vision specialist come there too, to the one in Meridian. And, when it comes to transportation, going back to that, some of these kids are able to go, if they're, health wise able to go to school, they can pick them up from school and bring them back. So like if they go to school a half day, then, because we want kiddos to have that, obviously inclusion. We want them to have the school experience, pick them up around lunchtime, come back home. And come back to the center if they need to get their tubes, their feeding started, their medicines in. They can come here, and parents don't have to go pick them up. They go pick them up from school and bring them to the facility. So it's beautiful. So, but they do have different teachers coming in and out. So I'm not sure. It doesn't say that there's a specific vision specialist on staff.
But if it's included in the IEP, then I would assume they would have access to, yes. But this is just
getting it worked out. Mm-hmm. It's beautiful. I told you they're beautiful places. They're beautiful, beautiful places.
And the fact that this isn't replicated everywhere is just mind-blowing. Okay, so folks, Mississippi gets a bad rap, but let's review. We have PPECs in Mississippi, and then Missy Schrader was on from Mississippi talking about the DeBard school that's down there. So, and they're like breaking ground for dyslexia and speech sound disorder literacy acquisition. So, let's not pick on Mississippi, although Bear loves singing the Mississippi song because he's like, I know how to spell her state now. Also, Bear, like, he's so in love with Miss Melissa that like she went home with like all the origami swans that are like.
And I love it. It makes my day because they're sitting right in front of me right now. So I just send you a picture so you can give it to them. But yes, we do get a bad rap sometimes. I didn't realize that that y'all didn't, PPECs weren't everywhere. But again, I didn't hear about them until 2017, so I don't even know how long they've been out. I don't know which states they are in. Maybe I should have researched that prior to talking. But they're phenomenal. To have nursing into the day facility, it's just, again, it's an answer to prayers for so many children. And two, when we're talking about the benefits, there's so many things that I can't even list. Do you want me to go into benefits? Because I'd love to go into that. You want me to?
Yes. Yeah, honey, you take the lead here.
Perfect. Okay. So obviously, we're sitting here talking about how wonderful PPECs are. And, right now, obviously, I do treat in a couple of my clinics, but when it comes to PPECs, I'm consulting with my employees there, mainly with the feeding kids. So I reached out to them and I said, okay, ladies, and I'm going to give a shout out to Leslie and to Jasmine and to Susie and to Rachel and to Erin. They are outstanding. I hope I did not did not forget anybody. No. So they are phenomenal. And I reached out to them and said, okay, let's all sit down and let's make a list of things when it comes to benefits of PPECs. And this was so fun because I mean, we do it on text and it was like, just all of the text starting to come through. And I'm just smiling and just going, this is the beautiful thing there. I mean, they are outstanding. They're outstanding there. But some of them that we were talking about, obviously, when we were talking about, with nurses on staff, one of the first and, the main things that my girls were saying is they're there for emergencies. As we all know, we have a lot of kiddos who have seizure disorder. We have, when it comes to, if there's aspiration precautions, all the things that, when you're in the field, you know what to look for, you know how to handle it, or I hope everybody knows how to handle it. But to have nursing there, whew, okay, that makes
Especially
you feel
with suctioning if they need it. Yes.
yeah, yes, suctioning by far, and it's when you have a trach kiddo. I mean, it's great. Now, I had to, I'm kind of reverting back. Once I went into the home health situation, it's one of the first things that was thrown out at me is Miss Mama handed me a suction and said, "Here you go," and I went, "Whoa, what?" I didn't know what she was doing. So now, obviously, I can, with parents, when they hand it to me, every single person is different on suctioning, but to have nursing there to help is outstanding. I mean, they just are present for emergencies. They're there for carryover is outstanding. It's like talking to a parent, as we tell parents, these are the things that we need to be done at home. But we can tell these ladies, because again, they're mainly ladies. I haven't had any male nurses in the PPECs just yet. It's kind of like with the therapy world. We don't have any males here working with us, but it's not because we don't want them, so
They just haven't made it that far. So if you're a male SLP, may I highly recommend Starkville, Mississippi.
come on, because these kids love it when, we have like interns come, they love it when there's a man there. They will work and do all kind of things. So come on, man, you can work in the pediatric world. It's fun. We have a blast, but we're able to, get with these nurses and tell them, okay, these are the things that we're doing during the day while you're with them. Let's incorporate those into what we're doing. Whether it comes to one thing that's a challenge is they have to have specific doctor's orders. Obviously, everything they do there is per doctor's orders. So if it's in the feeding world, we can make suggestions, but we have to do we have to get the doctor's orders changed to, for changing, the thickness, liquid thickness, or changing foods. We have to put that in doctor's orders, basically.
But that's why we engage in interprofessional education to understand the roles and responsibilities of all of the IPP team members to then engage in interprofessional practice so that you go into a PPEC and you're prepared for, hey, this patient needs to be on a tapered weaning protocol or whatever, but you know how to hold the conversation. So problem, solution. Yay.
One of the challenges we were talking about is we don't get to see the parents as much. However, it's so great because, in this little, I say rural, that's such a hard word to say, community, we don't get a lot of this big, huge team of we need the speech pathologist and the nutritionist and the all the doctors, GI, all onto a team. We aren't able to do that. I'll be honest. To be able to communicate as well. Now that's a goal of mine. I want to be able to do that, but our children's hospitals are hours away, so we have to make phone calls. But with this, it's pretty great because when we can call team meetings there. So let's say there's a kiddo. Yeah. So, I mean, we can walk hand in hand through difficult situations. A lot of times we've had to really be super involved, obviously, when it comes time to, we know a kiddo needs a feeding tube. And parents are not wanting it at all. But we have to sit them down, hold their hands, and tell them how wonderful a feeding tube can be, and sit down as a team and go, here's the deal. And when we sit down with the administrator, the nurses, the OT, PT, ST, if there's an educator on staff, I mean, we will all sit down and talk about the benefits. And obviously, the parent is in the center. and we will all almost kind of kumbaya hold hands and say, it's okay. We're here. We're your team. Your child needs this. Your child's going to thrive when he or she gets this. There may be some bumps along the way, but we're going to hold your hand. And I know it's a scary thing, but we're here for you. And that's a beautiful, beautiful thing. And so, one of my girls, when I was talking to her, she said, that's one of the most fantastic things when it comes to, we take a challenge and then, of not being able to communicate with the parents and then make that a benefit, because we can then sit down and go, look at this team. Nothing's better than a parent looking out and going, these are my people. They have my back. So it's outstanding. And I mean, like I said, I have one of my girls, Susie, she's being able to give both perspectives of parent and therapist, and she can't say enough good things about it because she has a team. When her son has something that happens, she has people she can call. She can sit down with people, and we all just kind of go, okay, it's going to be okay. Let's figure this out together. So she's not only a phenomenal speech pathologist, but she's a parent that can give perspective on that side of the world. So,
but what you just did, what that model is where they put the caregiver at the core of the team. And that's what we should be doing. And that can be so hard. And one of the drawbacks I find with doing home health therapy is that, yes, I'm in the home, which gives me so much more personal, intimate insight as to like the daily needs of this family, like where they really are on like Maslow's hierarchical need. But at the same time, we don't get the luxury of all being in the same place. And it's really, really hard when you're on a home health team to get OT-PT speech and, they're in the same room. And oftentimes, at least, I mean, from what I've seen here in South Carolina, the only way we can truly get nursing in the home is they have to have two profound medical needs. So you could have a child that has a diagnosis and a feeding tube, but having a genetic diagnosis and a feeding tube in and of itself may not be sufficient enough to get a nurse to grace your threshold. And the parents just burn out.
And I'm glad you mentioned the nursing in the home, because they can still, a lot of parents I think because this is skilled nursing, obviously, they actually can still get nursing in the home, and in addition to the PPECs. But I do say that it's different with every child. It's different with the complexities of their diagnoses, because they, the obviously the more complex the diagnosis, the more care they will receive, because again, insurance has to approve all of this, which again is a struggle, as we know. But I know many kids who are getting PPEC nursing and they get home nursing. So these parents are completely supported and loved and cared for with all of this care, but it has to be approved by insurance, obviously. But it's going by how much need they require. So if they need more oxygen, they need more, if there's different diagnoses, medicines, tube feedings, all the things, then obviously they'll be allowed more nursing. So.
I have a quick question, but Erin says to tell you hi.
I said hi.
Hi, Erin. Erin, it was all caps. Tell her hi.
I hope she's doing fantastic.
Yes, currently she's boxing her entire apartment to move to Cincinnati, but folks, just pretend it's not January.
Oh man, I bet she's boxing and crying. Oh my goodness.
Yeah.
Yes, please hold her down for me.
Yes. Okay. So we try to make it authentic and real here, folks. This is what you get in the world of speech therapy. Okay, no, wait. I have a technical question. When you guys are signing on to like contract, one, I do kind of want to know how you actually like branched out to contract into the PPEC. But then my next thought is, when you're writing the IEP to get the services, do you actually have the ability to write feeding goals on the IEP? Because like, this is amazing.
Yes. Oh, yes. So yes, like I said, when it comes to how we got into these facilities, like I said, in 2017, the wonderful PPEC and Meridian contacted us, and they first off we said, how do we even do this? So it's basically whenever we go for credentialing and all the insurance stuff, it's an additional address because we're basically essentially renting a room there in their facility to provide the therapy. So they contract with us. We treat there, but it's still our therapists. And so we have, obviously, we're in 3 different places. I never said that. We're in Meridian, and then we're one in Columbus, which is about 30 minutes from where I am now, because we have outpatient clinics here in Starkville, Mississippi, and Columbus, Mississippi. And so now we're providing therapy in PPECs in Columbus and in Starkville. So that's how wonderful they are. Early 2017 was Meridian, then later 2017 was Columbus, and then Starkville opened up in 2019. But to answer your question about goals and things, yes, we get a referral. We still get our referrals. Each child that's admitted, we will, to that facility, we will evaluate whenever we get specific orders. It'll still be doctor's orders the way that they send them to us here at the clinic on, to evaluate and treat as indicated. So we go in there, we do our evaluation and set goals. Now, of course, just like with any other kiddos, we're looking at, have we had our modified barium swallow? What is the recommendation for feeding right now? If we need to recommend one, if they haven't had one yet, we still go through all those things and then work hand in hand with the nurses and doctors to get the appropriate orders written for that child. So it's kind of function when it comes to therapy and how the therapy, everything kind of flows. It's like the same as clinic when it comes to paperwork and all those kind of things on setting goals and advancing. But there we do have to have specifics on the orders on, okay, if we're advancing textures, we're advancing that, and we need to get that through the doctor. So we're just kind of updating clinic cares and progress notes and all that kind of stuff.
That makes sense. It's like, to me, it almost sounds like a day hospital, like in that sense, like a scholarly day hospital that with like glue sticks and glitter, if that's how I imagine this. Or when you were describing it, that's how I was putting it together in my head. And I was like, that sounds dreamy, because here in South Carolina, we have, to my knowledge, we have three settings that are kind of similar. We've got a location down in the Low Country, like Charleston, like just the Low Country down by the coast. There's a place up in Greenville, and there's a small program here in Columbia that I'm most familiar with, and it's affiliated with the therapy place. Shout out to the therapy place. They're doing amazing work, and they have a day program called Bridges for 2 years to 6 years of age, where they have OT, PT, and speech on staff, but there's no nursing. And they have a special education director, and they have like one-to-one aides. And oftentimes the aides are individuals that are planning on pursuing a degree in allied health or, like pre-med, something of that nature. So like OT, PT, speech, like undergrad students, something of that nature. But it's close, but it stops at 6. And that's the thing is, I mean, we're in the state capital, and we don't have those opportunities. And I'm going to go out on a limb and say that by not having these opportunities for our caregivers, it holds the caregivers and the families back from reaching their personal, social, emotional, and financial and professional goals. And this is not a political statement, folks, so everybody take your politics and put them aside. But it's the same as not having daycare covered. I mean, I honestly felt like working poor when we were spending $1,200 a month in daycare so that I could go to work. My daycare when the kids were littler was more than our mortgage payment. And that was for me to go to work. And at one point in time, my husband turned to me and he was like, baby, he was like, honestly, we may want to consider you not working because you we spend almost as much as your salary, but I am not cut out to be a stay-at-home mom. No. Hats to you if you are, but that is not for me.
It's hard. These families don't have to make that decision because it is, that's when I say it's a Medicaid facility. So, I mean, that's the one thing I think that if you have private insurance, they don't pay it. But it is it's great. That's all the ones when I get kind of when it goes into the insurance stuff, I get a little confused on that. But that's like the first time I was like, so only kiddos with Medicaid can do this, and yeah, it is because it's a state thing, and that's just the way it is. But it's still fantastic for the kids that are there because I'm gonna have to FaceTime you one time and just kind of walk you through these places because they're happy and these kids are happy another benefit that one of my girls was telling me is they basically being able to provide therapy on it's kind of like most natural environment obviously but on their time because okay, the kiddos go down for a nap at so and so. Let's go ahead and get them before that, or we can see them communicate and interact with their kiddos at lunchtime and address their feeding at lunchtime with the other kids. So it's pretty fantastic. And then we can even be in there with the nurses and go, okay, when this child is doing this, sit the other child in front of them, get their high chairs because obviously a lot of them have medical needs, so they can't sit too close. But get them to where they can watch each other. Where our kiddo that is really struggling with this one area of feeding, let him watch his buddy and learn from each other. I mean, they're such sweet friends in there, and it's just so fun to watch them during those times. And then giving those opportunities for communication together. If they all have some, AAC devices, getting there, go, okay, during this activity, let's get those devices out and give them opportunities to communicate with each other. And then the nurses are they're so fun because they're learning from it too, because nurses don't come out of school going, oh, I know what an AAC is. No, no. I feel like we're benefiting them too, because we're able to, impart some wisdom on them too from our area. So, it's just really a fun place. They're all three fun places and they're run with the kid focused. I mean, all those nurses love those kids.
I love how organically we go from PFD to AAC because they are so like intimately intertwined and like inevitably, like if you have a kiddo that has a PFD, they probably would also benefit from, and it's like, yes. Yes. Also, I really think that we should be doing, okay, folks, this is just me putting a dream in the universe. I really think that as a profession, we should start doing more in-services into the nursing programs, especially for what you said, and like reaching out to like our local colleges and universities for like the pediatric geared nurses to talk about this is what a PFD is and this is how it can manifest and how you may see it. Also, how cool would it be? I'm dreaming big here. How cool would it be? Because that would be another buy-in for getting the RAC card, the 6 questionnaire screener, the PFD screener from Feeding Matters. Like we could get buy-in with some of the nurses that way. Like, hey, this is a great tool to catch this. And, oh, by the way, do an AAC in service with them because we're saving patients that we didn't see and have technology or tech that we didn't see like 20 years ago. Just some thoughts.
Yes. I mean, our heads kind of start, going all over the place. I'm literally going, oh, we could do this, and we could do this, and we can do this, and then we got to rein ourselves in, which we actually physically do. But it's in that respect, these kiddos, because that RAC card by Feeding Matters is phenomenal, and I need to get more out in the community and give them to all the doctors, and because. As we know, we'll have kids, here I go with PFD, I can't not talk about it. But, I have kiddos come to us, 3, 4 years old on a bottle because if their doctor was saying, are they feeding well? Yeah, they're doing good. Okay, moving on. So they could be doing, quote, good, to their parents but they don't feel like they can talk to them, and say, well, maybe this isn't a problem. But, let's step into a PPEC and the mom may say, oh, they're doing fine. And then the nurses say, okay, well, let's see what our diet is. And they're a 4-year-old just on a bottle. And they come to us and go, this isn't right? So, then we can get these kiddos to go, okay, what's going on here? Why are we not doing more? Why have we not caught this before? And in all the physicians, defense, they're busy. They have to ask specific questions. I know the world of that, and um, they see weight gain, and they don't see it as a problem if the parents are saying they're doing fine.
Because the
So
BMI is moving up, and which folks, a BMI is not an indicator of how that child's actually being nourished. So pull that with a complete metabolic panel and actually get in there and take a peek at how that kiddo's doing and then get back to us. But okay, well, y'all, Melissa sent the most detailed questions, and then we've gone 400 different directions. But what additional challenges do you guys run up against? What other barriers do y'all have?
I think, like I was saying, one of the big barriers is not seeing parents as much. However, like I was saying earlier, we take that barrier and go, okay, we're going to communicate through the nurse and say, these are the things we need to do. And then we can tell the parent that way. A lot of my girls, even the therapist in Meridian, she makes calls to parents a lot. So these struggles and challenges that we're facing, we try to, to the best of our ability, we try to defeat that in a way. But so we try to stay in contact. Sometimes we have tried to write little notes to parents on, this is what your child did. These are some things to do at home. But as we know, we get busy and we tell nurses, this is what we need to do. So, we try to visit and make some calls at least here, periodically to check in with the therapist. I'm sorry, with the parents. With anything, these nurses are phenomenal, but they also get busy just like we do. So that can be a challenge in and of itself too, because carryover may be a little bit limited. I mean, they're having to check all the medical situations on these kiddos, and they're like, hey, did you do, XYZ that we asked you yesterday? Well, no, they ran out of time. Always have to, be in their defense and going, they have a lot going, and they do, to the best of their ability, they really do to try to do as much as us, but their head is not exactly where ours is. If we're like, you didn't do so and so during feeding, well, that's where our head goes, not them. So, we take these challenges. Again, I had some fantastic therapists in there, and they really do a great job on trying to go, okay, well, they were busy today. Let's revisit that tomorrow. So, I mean,
but that's caregiver coaching. That's what we do. And that's the piece, is when we're going in and we're working with truly coaching the caregivers, it's, what is your stress? Where are you on your, backtrack. We have a family motto, and I'll tell the boys, and I'll tell my Mr. Dawson, all right, this is the drown day for mommy. And when it's a drown day, I am completely slammed from the moment I open my eyes to the moment I close my eyes at night. And we kind of go through, okay, well, mom needs to learn about balancing her plate. But alas, all moms do, right? I know I'm not alone. But when your caregivers are having a drown day, that may not be the day to overwhelm them with 14 additional strategies. But that's where us learning current evidence-based practice, but also really focusing on that counseling component. And y'all, there is a new special interest group, and God help me, I think it's special interest group 21 or 20. It's in the 20s now through ASHA. And it's specifically on counseling, which I think is phenomenal that's finally, we have a specific group for that, because that's your therapist having the emotional intelligence to go in, read the room, recognize that the nurse, who is the primary caregiver for maybe 10 hours out of a 24-hour cycle, is in a drown day moment, and being able to scale back her asks to meet where they are. That is a very fine skill that not all of us are graced with right out the gate, and we learn, myself included in that. But yeah,
comes with confidence too, as we know. I mean, it's just, the more years we're in this, we become more confident, competent, and then confident. So, I can't speak enough about the girls I have in there right now. I mean, they just are doing fantastic. And they are able to, like you said, you come out and you're like, okay, one of our biggest jobs is communicating to the caregiver appropriately and telling them exactly, what needs to be done in a realistic manner and knowing how to gauge that from child to child. What you ask of for one child is going to be different from the next. And what you ask of one child is obviously going to be different than the next because whether it be the medical situation or the home environment, we have to set these kids up for success. And we have to set up the caregivers for success. So we can't ask too much of them. And that's because again, going back to these phenomenal, nurses, if we ask so much of them that it overwhelms them from doing their day-to-day medical responsibilities, they're going to shut down and not do it. So just like with parents, and they'll feel defeated. And, like we were talking about with parents, putting a realistic expectation on parents in the homes, if we tell them unrealistic things to do there and they can't do them, they're going to feel defeated.
Yes. And then they don't want to do it.
Yeah. Yeah. So
we're supposed to build trust, and that's part of the trauma-informed care. This is the term that Erin uses. I knew I was going to get there, but yes.
Empower those parents, empower those caregivers. And it's so fun when we'll go into the PPECs and go, hey, Melissa, I did so-and-so, because I will go, the one here in Starkville, I'll kind of go in more, a little bit more. But look what this kiddo's doing. He's drinking from a straw. Or, they get so proud of themselves. And here's this phenomenal nurse that is caring beautifully for all these children. And then they'll, pull me to the side. Look what he's doing. Look what he's eating. I mean, so they just get so proud. They're like little parents too. I mean, you can't not be feel like a parent during the day if you have a kid for almost 10 hours a day. So, I mean, and they just get so much pride in their accomplishments that it just makes me want to cry sometimes. I mean, they're just again, I just can't say enough about these PPECs that, I mean, they're just a beautiful place. They really are. And we're blessed to be in them. I'd love to be in more just because I love to just watch it. I mean, it's just fun to see these kids that would otherwise be at home and be, just isolated. Yes, socially isolated. The parents are isolated. I mean, everything about these kiddos has usually been isolated. I mean, because when I was way back when in the homes, because it was way back when, these kids never got out. It sometimes wasn't safe for them to get out, but also parents would get so many questions and they would just rather stay at home. So it's so cool to see all these kids in one place and having fun.
Okay, so I have 3 questions. Two questions. One, do they offer like support groups like mom moments or like they drop their babies off at school and then they're going to have like a coffee hour once a month with like an in-service, because that to me would be like a phenomenal opportunity. And 2, what happened to the PPECs during COVID?
Okay, that's a good question. So first, unfortunately, I've not heard of any parent support groups. However, I think a lot of the parents probably run into each other when they're picking their kids up, and maybe chit chat. And I know some of them that are good friends. So but it needs to just like with everything, I would love to have more of a more involvement on getting these parents together.
Okay, I have a solution. I have an idea. One, and I just learned about this like a month ago. I didn't know about this beforehand. Well, 2 months ago. National Foundation of Swallowing Disorders, they have a free pediatric feeding group Zoom once a month. It's on a Thursday. It's NFOSD, and you can find them online. And I'll have to call them back. You can find them online on their Instagram account, and it has a link. And what happens is they'll have pediatric SLPs. Donna Edwards, who's board certified specialist in swallowing disorders, she's an ASHA fellow. Donna is just a ray of sunshine. And just moved to Florida. I'm very excited for her. She was very excited. She's like, I'm not going to have to deal with snow anymore. But like Donna tends to be one of the what is it called? Hostess, like the hostess of the meetings. So they give guidance, but they don't give advice, right? And which is a very fine line, because I volunteered once and this was a very fine line to walk, right? But it's free. And you know the power of two. Yes. Okay. But I didn't know that, like, it's really cool to have like that face-to-face interaction on the Zoom. So it's NFOSD. But also, if you're listening, folks, I know Melissa knows this, but Feeding Matters has the Power of Two program where one caregiver can mentor another caregiver, and they partner you through your state, and it's all volunteer as well. So then some people want that face-to-face connection that a Zoom will give, and some want a phone call or a voice on the other side that, you know, the Power of Two can give. So you got options. Okay, now tell me about the COVID.
Okay,
Not COVID, but
yeah.
yeah.
All the things about the COVID. They remained open. Thank the Lord, they remained open with many, many, many universal precautions in place, PPEs. I mean, it was very specific on, they had to have the mega masks on, anybody that worked there. They all had vaccines that were treating and nurses, and they didn't get the kids real close together, I don't think. But I mean, how can you really keep little ones apart? It's impossible. But they remained open for the most part. If I remember correctly, I don't even remember if they closed at all. Maybe they did very initially, but I don't think they did. They were open throughout it. So it was great. But again, masks were very, very in place. And I think even at one point we were wearing some gear. So some even more than masks, and maybe a face shield too. So, but they remained open. That was beautiful, because these kids, I'll be honest, when it comes to different home environments, as we know, sometimes when they're getting the most medical care they'll receive throughout the day, whether it be all the correct medications. So it can be detrimental for a kiddo not to come, because they'll even see it like on Mondays when kids come back, they're like, their reflux is out of control, probably because we haven't had meds. So, throughout the weekends, that's a struggle, but we make do and we accommodate. And it's a big, big picture of IPP. I mean, it's huge interprofessional practice. We are able to, like we're saying, we are able to be with, work with these nurses, with PTs, OTs. And what's great about the nurses, they can help make these referrals too. I wanted to throw that in there. Mm-hmm. Yep. So if we say, hey, this kiddo really needs a follow-up swallow study, if we can't really get it done, with the doctor, these doctors around here are great about, referring, but they'll make those calls. So, I mean, they're just fantastic.
And that's unique. So folks, nursing license, also like dental hygienist license, varies state by state. So in some states, nurses have more in their license and in their scope of practice than in others. And I didn't know that until about the dental hygienist until our dentist retired. Dr. Jackson retired. I was devastated. I liked him. He had a grandson with autism, and he and I would always talk shop like while I was there getting my teeth cleaned, which consisted of me doing like gestures and grunts because he's cleaning my teeth, but like all the things. But his hygienist was he'd hired a new hygienist from Texas, maybe. She was military bride, so she had just come in from another base, and she was talking about like the variations in her license and scope and how she could give recommendations in whatever state she came from that she hadn't gotten used to not being able to give that in our state. So like you were saying, the nurse can, so it's important. So if you have a PPEC or a kissing cousin, like a situation similar, you might want to seek to understand what is the scope of the caregivers that are there in the facility so that you can best engage in IPP.
And that's perfect. And one thing to add when it comes to the nurses, they have to have pediatric experience. So that is one thing that is a benefit, but also sometimes a challenge, because, and I know in our area, finding pediatric nurses are hard because, again, we don't have a pediatric hospital. The closest one is 2 hours away. So, and we have to be pediatric therapists too. So each therapist, like I can't, if I hire a speech pathologist that's been in the nursing home and doesn't have any pediatric experience, I can't place her in one of the PPECs. They have to have at least 1 year of pediatric experience. It's great. I mean, there's just so many benefits. And again, going back to what you said, to be able to make referrals is to help with referrals is just another benefit. So,
okay, I have one last question, well, two last questions, but do you find that engaging within the framework of the PPEC that you have easier access to the patient's medical records than when you did?
Yes.
Yeah.
Yes, absolutely. Because, they have, I know the one in Meridian, they have a huge chart. The one in Meridian and Starkville, I think they all do. They have huge charts basically that they keep in their office basically for each child. I mean, they're thick. They're obviously thick. So you can flip through there and go, okay, here's his plan of care. Here's all of his records. And they can access the medical records from the hospital too. They can get online and do that too. So it's, yes. So that answer is definitely, because as we know, when we're doing, an evaluation with our kiddos here at the clinics, it's up to the parents to give us that information, and that's unfair to them. They aren't supposed to know all the big terminologies and what exactly was said during a swallow study or exactly was done, what procedure was done, what surgery was done. They are already overwhelmed. So yes, it's fantastic in there because we can go, okay, can you give me those records so I can flip through them and read everything that's happened? So it's great. It's definitely helpful.
You and I could talk for hours. Good Lord. Okay. So what parting words of wisdom do you want if somebody's interested in working in a PPEC, or like me sitting here thinking, how can we establish a PPEC, or just like final thoughts?
I wish I could say I knew how to establish a PPEC, because that's more of the people who own those. I would love it if, I knew all that, but I guess looking and finding finding any of them, looking if there are PPECs in your state, and for any therapist who's thinking about treating in one, do it. I mean, it will bless your heart. It will bless your soul. You will just want to, I know myself, I wanted to cry when I went in there and when I every time I go in there, because they are just such sweet kiddos and it's just a good, sweet group. And you're able to see these nurses that love on them and everybody just coming together as a team. So if in doubt, do it. It's challenging because these kiddos, yes, they are medically complex. Their diagnoses are long. They're just super complex. The children are challenging. The therapy is challenging, but as we know, it's rewarding, and it's my passion. So, do it. Please do it. We need some phenomenal therapists in the PPECs. So, but that's it. Thank you for having me. I've loved it.
Oh my gosh. Pick a topic, come back, let's do another one. Table is open. My microphone is open.
I get a new microphone, and I'm going to text you a picture and a little bit of myself. This has been special. I probably have an imprint of my desk, like on my stomach.
I like how you edited that from your hoo-has.
You got to do what you got to do. But I'm going to send you a picture, and you go, "Wow, that was impressive."
That is awesome.
My lower back hurts a little bit later on. Thank you for having me.
Yes. Also, folks, I just have to say, she literally has the prettiest keyboard I've ever seen, and I've been looking at it over her shoulder. One, it's set to look and feel like a typewriter, but two, it looks like a pretty makeup palette. And so, please send a picture of the keyboard too.
I definitely will. It's fun, because we got to have fun when we're typing, because we have to type on our own. So, thank you for having me, Michelle. I appreciate you.
Thank you, lady. All right, folks, be sure to check us out at First Bite Podcast on Instagram, on Facebook. We love it when you spread kind words on the First Bite Podcast reviews on Apple Podcast. And I'm going to go out on a limb and say that if you have any extra love money left over this month, Melissa and I would greatly appreciate if you'd donate your time, your talents, or your monies to Feeding Matters. And I would consider that very much a wonderful 40th birthday present. So huzzah, cheers for 40. May the wine be strong, the Botox be gentle, and the hair gel stick.
Happy birthday.
Thanks, lady. Bye.
Feeding Matters guides system-wide changes by uniting caregivers, professionals, and community partners under the Pediatric Feeding Disorder Alliance. So what is this alliance? The Alliance is an open access collaborative community focused on achieving strategic goals within 3 focus areas: education, advocacy, and research. So who is the Alliance? It's you. The Alliance is open to any person passionate about improving care for children with a pediatric feeding disorder. To date, 187 professionals, caregivers, and partners have joined the Alliance. You can join today by visiting the Feeding Matters website at www.feedingmatters.org. Click on PFD Alliance tab and sign up today. Change is possible when we work together. That's a wrap, folks. Once again, thank you for listening to First Bite, fed, fun, and functional. I'm your humble but yet sassy host, Michelle Dawson, the All Things Peds SLP. This podcast is part of a course offered for continuing education through speechtherapypd.com. Please check out the website if you'd like to learn more about CEU opportunities for this episode, as well as the ones that are archived. And as always, remember, feed your mind, feed your soul, be kind, and feed those babies.
Hey, so it's Michelle Dawson here, and I need to lay out my disclosure statements. So if you ever wondered how bad my ADD, ADHD, and lack of sleep Monday through Monday actually is, well, here you go. These are my non-financial disclosure statements. I volunteer with Feeding Matters. I'm a former treasurer with the Council of State Association Presidents. I'm a past president with the South Carolina Speech Language Hearing Association. I am a current member of both ASHA and SCISHA. And for this year, for 2021, I volunteered for the Pediatric Feeding Disorder Planning Committee for the ASHA 2021 convention. My financial disclosures. All right, so I receive compensation for First Bite presentations as well as talking teletherapy and understanding dysphagia from speechtherapypd.com. I also receive royalties from speechtherapypd.com for ongoing webinars that I have on their website, as well as compensation from PESI Incorporate for a lecture course webinar that I have on their website as well. I am coordinator for clinical education and clinical assistant professor for the Masters of Speech Language Pathology program at Francis Marion University in Florence, South Carolina, for which I receive an annual salary. I also receive royalties from the sale of my book, Chasing the Swallow, Truth, Science, and Hope for Pediatric Feeding and Swallowing Disorders, that I self-published and is available on Amazon. And I do receive royalties from the accompanying 13.5-hour CEU for the book from speechtherapypd.com. So yeah, I stay pretty busy, but those are my financial and non-financial disclosures. If you ever have any questions, please feel free to reach out. All right. Thanks, y'all. Bye.
The views and opinions expressed in today's podcast do not reflect the organizations associated with the speakers and are their views and opinions solely.